and welcome to Health Talk. With us today is Barbara Walker, a registered nurse and certified diabetes educator. Today we're going to be talking about diabetes medications. In a previous segment on diabetes management, it was mentioned that medications are available for people with diabetes. Why do people with diabetes need to take medications?
The disease of diabetes is really quite complex, but it can be simplified by thinking the problem is with insulin. Every human body makes insulin. When a person has diabetes, they're not making as much insulin as they need to keep their blood glucose or blood sugar level in balance, or the insulin they're making just doesn't work as well as it used to. And this involves many chemicals in the body. So we now have many different kinds of medications to help keep the blood glucose level in balance.
Do all people with diabetes need to take medications?
No, they don't. There's actually 3 different classifications of diabetes. We have pre-diabetes, meaning that the blood sugars are just a little bit elevated. We used to call it borderline. Many times they do not need to take medications. We have people with type 2 diabetes. That was used to be called adult diabetes. For the pre-diabetes patients and the adult diabetes or type 2s, diet and exercise can be effective enough to keep the blood glucose in control. However, only about 10% of the population is able to do it with diet and exercise alone. So oral medications are necessary. With type 1 diabetes, we used to call that juvenile diabetes, those people always have to take insulin, and they take it from the day of diagnosis because their body has stopped making it.
What kinds of medications are available to treat diabetes?
We have oral medications, that's just a fancy name for pills. We have insulin, which needs to be injected, and some newer medications that also need to be injected but are not insulin to help our folks balance their blood sugars for their diabetes.
Tell me more about the pills that are available to treat diabetes.
The pills for diabetes actually act on different parts of the body which help balance the blood glucose level. And there's actually 7 different categories of them. The first classification are called sulfonylureas, such as Amaryl or glipizide or glyburide, and their job is to help the body make more insulin. We have meglitinides, which also help the body make more insulin, but that is specifically in response to food. We have insulin sensitizers, such as Actose. Their job is to help the body's own insulin work more efficiently. Biguanides, this is the classification that's most commonly used for type 2 diabetes. The name is metformin or glucophage. They work as a sensitizer, but they also help the human body make less glucose, another problem that our folks with diabetes have. We have alpha-glucosidase inhibitors, and they slow the digestion of carbohydrates. Carbohydrates are the foods that make the blood sugar go up, so if we slow how quickly they're digested, the blood sugar is less likely to go up. The 6th category is rather new. They're called bile acid sequestrants, and there's only one medication in that category called Welchol. And Welchol's been on the market for an extremely long time, and it was originally invented to help control cholesterol. In April of 2008, they discovered that it also helps control blood sugar. And then the last classification is also rather new, is called the incretin system, and it works with chemicals in the person's stomach and intestines to help control the blood sugar. Januvia and Onglyza are the 2 from that category.
Can you tell me more about insulin?
Certainly. Insulin is the most effective treatment when it comes to controlling blood sugars, and it actually has the fewest side effects. One of the major problems with diabetes is there's not enough insulin in the person's system to control the blood sugar. By taking insulin injections, we're actually supplementing what the body's not making enough of. When we classify insulin, we classify it by how quickly it begins to work. We have rapid-acting insulins, which start working in about 5 minutes, and they're out of the system in about 4 hours. We have short-acting insulins, which start working in about 30 to 60 minutes, and they last about 6 to 8 hours in the system. Intermediate-acting insulins, which a person generally takes just twice a day, and long-acting insulins, which can last up to 24 hours on one injection. Depending on the person's need, that's what the doctor will prescribe. Many times the long-acting insulins, Lantus and Levemir, are added while the person is still on the pills to try to help improve their blood glucose control. If the long-acting with the pills don't do the job, then the doctor may discontinue the pills and add a rapid-acting insulin. The rapid-acting insulin helps keep the blood glucose from going too high after a meal. In fact, when we teach the people how to take this insulin, the poem we tell them is, when the meal is hot, take the shot. The regular insulin, the short-acting and the intermediate-acting, are often combined into 2 insulins. So the person can take 2 shots a day, one with breakfast and one with supper, and be getting 2 different kinds of insulin. And they come pre-mixed in a bottle, and the name of them is actually a fraction. We have 75-25, 70-30, and 50-50, and that actually tells us the percentages of what kind of insulin is in the bottle.
Tell me more about the injectable medications that are not insulin.
This is a relatively new area in the treatment of diabetes. There's 3 of them available now. We have Byetta, Symlin, and Victoza. And even though they're given by injections, they are not insulin. They are working with other systems of the body, such as the chemicals in the stomach and the intestine, to help the body produce more insulin, make less sugar. It slows the digestion of carbohydrates, which slows the increase in the blood sugar. People feel full longer, and we're also seeing some weight loss for our patients that need to lose some pounds. And when it comes to giving insulin, many people think of the bottles and syringes that we had many years ago, and those are still available for our folks who want to use them. But the newer devices we have are called insulin pens. And with these, the dose is dialed up, making it much easier for people who have visual problems or coordination problems, maybe arthritis, and the needle is just attached for every dose. And the newest technology are called insulin pumps. These are actually little computers that are attached to the person and programmed to give them insulin 24 hours a day, 7 days a week, but then they also communicate with this pump based on what their current blood glucose reading is and how many carbohydrates they eat, so they can individualize their insulin dosing for their daily needs. With the injections, a lot of people are very worried about the needles. The nice thing that's happened in the world of diabetes is the needles have become much smaller, much thinner, and most of the people who are taking insulin tell me it hurts worse to check their blood sugars at home than it does to take a shot. And the insulins we have are made exactly like what the human body makes. So we're working more with nature than against it to help people control their blood sugars and trying to make it easier so people can follow their daily routines.
Are there any side effects to the medication?
Well, all medications have side effects, even over-the-counter the medications. If you take too much Tylenol, it can affect your liver. So all medications have side effects. When it comes to the diabetes medications, the most common side effects are stomach upset and diarrhea. Some people complain of weight gain or fluid retention. And of course, we hear about the blood sugars going lower than we want them to be. Our goal in managing diabetes is to have a person with diabetes blood sugar just like someone without diabetes. And in trying to do that, sometimes the blood sugars do drop too low. So part of the education is that people are taught how to recognize the symptoms of a low blood sugar reaction and what they need to do about it.
What are some safety precautions that people who take medications for diabetes should take?
There's a few things that we really stress for our folks with diabetes. One of the things we encourage them to do is have some sort of a medical alert, whether it's a bracelet or a necklace, anything that will identify them as a person with diabetes in case they are unable to speak for themselves. And these you can order from companies, you can get them from local jewelry stores, but having a medical alert does save lives. I also encourage our patients to always carry a list of medications. The first question they ask you at the doctor's office or the emergency room is, what pills do you take? So having a list of your medicines that includes your diabetes pills, your blood pressure pills, insulins, puffers, and allergies can also provide some safety. There's a program called the ICE program, I-C-E, and it stands for In Case of Emergency. And this was invented by a paramedic. He said you go to accidents, there's cell phones everywhere, and you don't know who to call. So putting the letters ICE before the person that you would want contacted in case of an emergency would allow that paramedic to contact who you would want contacted for, that you're going to the hospital or whatever. I have my husband is my ICE number 1 and my husband is my ICE number 2. My sister's a registered nurse. We encourage people with diabetes to eat at regular times. This is going to help work better with the medications that they take. They should take their medications as ordered. If the doctor says, take your pills with meals, he means take your pills with meals. You should always carry a fast-acting carbohydrate or something that has glucose or sugar in it, such as a roll of Lifesavers. That way, if the blood sugar does go too low, you have food with you at all times. We encourage people with diabetes to test on a regular basis. That way they know how their blood glucose responds to meals, medicines, exercise, stress. Especially if the doctor has made a recent change in their medications or they're ill, we would want them to test more frequently. We also tell folks with diabetes to exercise with a friend. That way you have good support if there is a problem. So there's lots of little safety tips that can go along with the medications for folks with diabetes.
Great. Well, thank you, Barbara.
You're welcome.
That's about all the time we have for today. For more information on diabetes medications, you can visit us at www.ogh.org. Thanks for watching Health Talk.
Diabetes education classes are offered at Olean General Hospital. For more information, please call 716-375-4127.